Fentanyl was not anything that we had even started to hear about when we lost Sean. He went someplace with unfamiliar people, to an unfamiliar dealer. It turns out that what he was given was a capsule filled with pure fentanyl. There wasn't even any heroin that was in his system. The saving grace here is because it was fentanyl, he was gone immediately.
Fentanyl is a legitimate opioid prescription used for pain. However, what's really flooding the market is illicitly produced fentanyl. We understand from the DEA that it is coming from China. It's 50 to 100 times more potent than morphine, and many people don't even know that they are taking it. It is undetectable from the traditional products that they were using with heroin and cocaine. There's no quality control in the street. Every time you are using an illegal substance, you are taking a risk that you will die because of this drug that's flooding our market.
We lived about 10 miles away from here in Baltimore County, and then we moved out here when Sean was in the 4th grade. And so he graduated with almost everybody that he went to school with in the 4th grade. Everybody knows everybody. It's a small town. He had tons of friends, from football players and cheerleaders to the kids in the band. He loved baseball. He played baseball his entire life. I think he was 21 when he played in the tournament. He was asked to join a team. Little did I know he was in active addiction. He had already started using pills at that point in time. There was a couple of red flags, but he wasn't living at home. But never in a million years did I think that it was heroin. He had a job, he had a girlfriend, he had a car. He finally came to me and said, you know, we need to get help. He said that he had been addicted for 4 months. Looking back, I think that it was obviously much longer. Sean turned 23 on December 14th. And the following Monday is when Sean overdosed. At 4:34 that afternoon, I had the absolute worst feeling I've ever had in my entire life. Came home from the gym. I think I was still in my gym clothes when the police officer showed up. So they had responded to an overdose in Mount Airy, and they were unable to revive him. They worked on him for 50 minutes from Mount Airy to Frederick Memorial Hospital. The EMT said that he had seen enough of these to know that they were not called right away. So we don't know how long they drove around with Sean. We don't know if they were freaking out, afraid they were going to get in trouble. The one young man was from out of town, so Sean didn't even know him.
Opioid overdoses have been happening for some time, and they are on the increase. So fentanyl is just becoming a larger contributor to the number of overdoses happening. What we have been working on is related to trying to address the problem both at its critical point with naloxone as well as the long-term point, and trying to prevent upstream. The Good Sam Law is really formally called the Good Samaritan Law, and it was passed in legislation to prevent individuals from fearing being arrested at the time of calling for help because of an overdose. The other program that we have as a state is the Prescription Drug Monitoring Program, and this is where prescriptions must be entered into the PDMP once dispensed. Many individuals who are now using street drugs started with prescription medication.
When he started experimenting with the pills, he wasn't living at home. So I still don't know exactly how that started. I do know that he was supplied by an adult that I trusted. It could have been something as innocent as he was at her house that weekend. He had a migraine, she was already on pain medicine, and she said, hey, why don't you take one of these, it might help. And that just, it just took off from there.
We all know someone who has had a problem with substances or has overdosed and died. It's really tragic. What we want consumers to know is that, first of all, this is common. There's a lot of stigma attached to having a substance use disorder, and we want to remove that stigma because it happens way too often in our communities and in our families. We cannot arrest our way out of this. We cannot market our way out of this by saying don't use. Even law enforcement has acknowledged that this is a problem that public health is taking ownership of and needs to be the lead in managing those individuals who are struggling.
I became involved with Maryland Heroin Awareness probably a year after I lost Sean. I found my son's voice about a month after I lost him, and I couldn't stay quiet with the information that I knew. I needed to find a way to get it out there, and that was our best way possible, was just kind of start our own thing, and we haven't been quiet since. The face of the heroin user has changed. It's no longer the 30-year-old guy hanging out by the dumpster and he looks like he's 60 years old. It's a football player, it's a cheerleader, it's a straight A student, it's a kid, you know, on the dean's list in his third year in college.
This is a disease. This is not anything other than a disease, just as hypertension is a disease, just as diabetes is a disease. It's a chronic disease, it's lifelong. We do not have perfect solutions to this. But what we have works, and we just need to make the best use of it.
Sean is a victim of fentanyl getting its name. They were putting it out on the market, and they were saying, look what we have now. We have something else. We have something that's going to bust through your methadone. We have something that's going to bust through your Suboxone. Sean was a great friend. He was a funny kid. He made it his job to make you laugh. If he walked into a room and somebody wasn't smiling, he didn't care who they were. He didn't care if you knew him or not. He would know you by the time you left, or you would know him, and you would be smiling one way or the other because that was his job, was to make you smile. So I guess now his job is to make sure you survive.